I am delighted to have in studio with me today Dr. Kenneth Rogers, the State Director for the South Carolina Department of Mental Health. Thank you so much for being here with us today.
Absolutely. Thank you for having me.
Well, I wanted to have you in because for the last several shows we've been talking a good bit about COVID and what COVID-19 is doing, particularly in communities of color and across our state. But before we delve into the particulars of what mental health is all about and what you are doing at the agency, I want to just talk a little bit about you being back in South Carolina. You hail from South Carolina.
I am. I'm a native South Carolinian.
All right. We got one back, y'all.
From the big city of Dillon, South Carolina.
Oh, wow. Oh, wow. We've been to Dillon. We've taken the tour to Dillon. And so tell me, how is it that you find yourself at the Department of Mental Health?
Well, I left South Carolina back in 2002. Moved to Maryland for a few years. Was at Johns Hopkins and University of Maryland. Then ended up in Greenville for about 10 years to help start the medical school there.
I didn't know that.
Yeah, and loved Greenville. Thought it was a wonderful, wonderful area to be in. And then decided to midlife crisis, moved to Dallas, Texas, and took a job at UT Southwestern. And then when the director of mental health came open, I decided to apply for it and move back to South Carolina. It's one of those jobs that's always intrigued me for a very long time. Grew up in the Department of Mental Health. I was a resident there. I was a child fellow there. My first job was at DMH. And so it was really a chance to come back and I think give back to a department that really helped me get launched on a really great career that I've really enjoyed.
Well, we are delighted, like I said, to have you back, and it's good when we can get people that I know other states by to have come back home and share their time and talent with us. So thank you for doing that. Now,
as Dorothy says, there's no place like home.
No place like home. That's right. Well, let's talk a little bit about the agency and what you all are facing over at Mental Health, given what we are seeing now with this pandemic. I know that a lot of people are feeling somewhat isolated. There are issues that are emotional issues, mental health issues. What are you seeing out there as you look and you serve people in the state of South Carolina?
Well, one of the things I'll do first is really brag about the agency just a little bit. Next year will be our 200th year at DMH. We were one of the first departments in the country to develop telemedicine services, and that we've had those for about 20 years now.
Really?
Duke Endowment gave us a grant about 20 years ago to develop telemedicine services. It's actually been renewed twice now, and so as a result, we're providing services in many of the emergency rooms throughout the state. We also provide a lot of outpatient services through tele. And so when the pandemic hit, it allowed us to move into a space where we could really shift very, very quickly. And so almost immediately we were able to close many of our centers to people coming into the center, but we're able to meet those people's needs through telemedicine. When we first started out, what we found is that many folks that we were providing services for before weren't able to come into the center. We had a lot of people who were lost to follow up and weren't seeing us. But now we're actually down to 0.01% of the people that we were seeing before the pandemic hit that we haven't gotten in contact with at this point. So we're doing a really, really good job there. We have done a lot of services directly to home. We've used telephone for a lot of services. We're trying to reduce those numbers at this point because we know that in terms of privacy and ability to kind of control things, not great. But we're doing a lot more telemedicine. We're doing more coming into the office now, especially for new appointments. We do a lot of school-based services.
I was wondering about schools.
Yeah, and so having this hybrid model or a lot of kids being out of school has posed some challenges, but we're actually going into homes with families through tele. And that's actually worked relatively well for us. And so overall, I think we're doing a good job. What we're starting to see is our numbers are creeping up. As more people are becoming stressed with everything that's going on, with being willing to actually seek help. Because during the early parts of the pandemic, people really didn't want to come out of their houses and see anybody.
Right.
So if you're already anxious, you're already depressed, the whole idea of going to seek help was almost a foreign concept. But we're seeing people that are getting distressed enough now that they are actually seeking care. And so those numbers are starting to rise.
That's interesting. I want to delve in a little bit about the telehealth, mental health services that you do for students, because I think that's so critical. But if you have a situation where, for our viewers, where a person is concerned about a family member or a loved one possibly doing something dangerous, even how do they handle that? What should they do, given where we are with this pandemic now, to help them?
So the first thing I always say is see if you can talk the person into going in for help. So that's always the first thing, because if you can get them to actually seek help on their own, that's going to be the best thing. If you still feel like they're at risk, there are really two ways of doing things. The first one is you can actually approach an emergency department or the Department of Mental Health and say, I have a brother, sister, family member, parent, child who's not willing to come in, but really I think is in danger. And they can do what's called an emergency commitment to get the person to actually go to the emergency room to be evaluated. The second thing is you can actually approach the courts, and the courts can do a judicial commitment. So the judge can actually order someone to come in for an evaluation as well. So between those two types of commitments, at least you can get somebody to come in, have somebody take a look, and help determine what kind of services are available and would be appropriate for them.
That's really important, especially now.
Absolutely.
Because we have a situation with the pandemic where we're just in a place that a lot of people have never been in before. For the first time, they're homeless. For the first time, they don't have the money to pay for food. So it's really important to have that ability. I know we talked about this before we started, that a lot of the folk in our state and across the country actually have elderly parents who are in nursing homes, who are experiencing severe levels of loneliness. Those parents, as well as we're seeing some of those children, those adults who can't go and visit. What is that doing to your numbers? Are you seeing a lot of people who may never have sought emotional or mental health services seeking them now?
Absolutely. Isolation is a huge issue. It's a huge issue for the elderly, but it's also a huge issue for a lot of our younger population as well. You've got a lot of young people, 25 to 30-year-old, who are away from home, who are afraid to go out and see friends. You've got folks in nursing homes that, of course, it's difficult to get in. It's almost impossible at this point. But the biggest challenge I see is actually the number of elderly people who are at home and living at home, and their kids feel uncomfortable seeing them as frequently as they have before. And so you're seeing a lot of elderly people who would have previously had kids dropping by, checking in on mom or dad, who are less willing to do that. I won't say less willing, more afraid to do that now than they would have in the past. And so you see more isolation on the parent side, but also a lot of guilt on the child side.
And does your agency provide some type of counseling services in those instances, or do you just how is that dealt with?
Well, we have a what we call the SC Hopes line, 1-844-SC-HOPES, and you could actually call that Hope line. And if you're in distress, you feel like there are things going on that you're trying to work through, if you call that number, what they can do is actually work with you, one, to figure out what kind of services would be available, what do we offer, how can we plug you into the right place, and also provide some support right there on the phone for anyone. It's a free service. It's paid for through a federal grant. I think it's really one of the best things that we have going. We've had about almost 900 people call into the Hopes line so far. And so I think that would be a great place to start. And even when you were talking earlier about what you do if you're a family member, 1-844-SC-HOPES is probably a good place to start.
And I'm going to get you to repeat that number one more time.
It's 1-844-SC-HOPES, H-O-P-E-S.
Good. One last thing that I want to go back to just for a second, and you talked about mental health through telehealth services for students. We're going to need a lot of that in South Carolina as we try to get our students back to full five-day classes. Are you partnering with school districts to do that, or is that something that you're doing by the children being at home?
Oh, no, our school mental health programs are actually in schools. So when kids are in schools, we have a clinician that's embedded, that's part of the school, that's there every day of the week. We've done tele through this time period, mainly because schools have been out, or we've been in this hybrid model. But once schools are back in session, we will go back to 24/7, 5-day-a-week services in schools.
Well, it looks like our time went by so fast. Dr.
It's
Rogers,
flown.
thank you so very much for all the things that y'all are doing over at Mental Health. Thank you for being here today and sharing with our viewers the services that are available.
Well, thanks for helping us get the word out on mental health and what we're doing, and hopefully if folks need our services, 1-844-SC-HOPES.
Well, we'll have to get you back in because there's so many other aspects of mental health that we just didn't get a chance to touch on today, but thank you for being here.
Thank you.
So stay where you are. For More Woman Magazine, we'll be right back.
So they say it's a man's world? Well, I don't see anybody's name on it. While they were out doing their thing, we slowly changed all that. We changed all that. Today, women can do anything men can do. And there's one thing we're even better at.
Thank you for staying with us. As you can see, we are all masked up, and I am happy to have in studio with me Tiffany James.
Hi.
Tiffany, thank you so much for coming today.
Thank you for having me.
Well, let me tell you this. Tiffany she wears many, many hats in our state. Extremely strong community activist, and we appreciate all the work that you do. And you've started something or been a part of something in South Carolina called End Coronavirus. And today, after hearing the numbers, the record-breaking numbers, over 3,000 cases today alone, we definitely need to end coronavirus. Can you tell us a little bit about how you got involved in the organization?
Yes, absolutely. Well, I was contacted by DHEC to be a part of their environmental justice committee to help get the word out about COVID-19 to marginalized communities. And so one of my friends, he had a friend who was involved with End Coronavirus. And so his friend contacted him and said, we need somebody that's on the ground that's doing the work. And I don't know many people doing that. And then, so he connected us. And from then on, I was with End Coronavirus and I brought it to South Carolina.
Well, that is so wonderful. And you were telling me before the show started that it's a national organization?
Yes.
Tell us a little bit about what, obviously they want to end coronavirus,
Yes.
but tell us a little bit about the overall objective.
Absolutely. And actually, it's an international organization.
Oh, wow.
Yeah,
Okay.
it's comprised of scientists and doctors and activists from around the world whose mission is to crush the curve. Not to bend the curve, not to flatten the curve, but to crush it because they believe that we can. All it takes is 5 weeks to do a strict lockdown and we can actually get rid of the virus. So that is a message that they were putting forward since the beginning of this outbreak that we've had.
So is yours more of an educational type of thing where you're going around letting people know what to do to prevent contracting coronavirus? What exactly are you doing out there in the community?
No, absolutely. So we are, I guess you could say, public information, education organization. In coronavirus, the global organization, they provide us with technical assistance. So they have scientists who are consulting people here on the ground, whether they're restaurant owners, business leaders, elected officials, whoever wants to have like a scientist or a global pandemic expert, just outlook on what's going on. Because everything is on the news. We hear, what we should do from scientists on the news, whether you're watching like CNN or local news, but very seldom do we have the chance to talk to scientists one-on-one. And so we've been able to provide that and bring it to our communities to help people combat COVID.
That is really important because, especially now as we start dealing with the vaccine, because the science of it is what's being challenged. The science
Absolutely.
of it is what our communities, particularly communities of color, need to feel confident in because of the history we've had as being quote unquote guinea pigs. So we have to get beyond that to try to be able to educate people.
Absolutely.
Now, girl, I have to say this. It warms my heart to see you, such a young person, out here all the time engaging communities to try to make them better. I mean, where do you get that community spirit from?
Yeah, thank you. You know, I get that community spirit from my parents, from my church, AME. I've been raised AME, and my parents.
So am I.
Oh, great! So my parents always had me involved with youth services, and I was, a leader in my community through my church, and also our ancestors. So just learning about the history of our people and what they've accomplished, like Sojourner Truth and Fannie Lou Hamer, and just so many black women and just black people who has did what they can with the little that they had, and that's so inspiring for me, and it's always been. So that's kind of what's kept me going. My parents and church and our ancestors.
Well, we are delighted that you had such good parents and that the AME Church is a strong believer in community activism.
That's
I know
right.
this for a fact.
They are.
And because it really is important for your generation
Absolutely.
and even younger to know the importance of giving back and getting involved in their community to try to make it better.
Yeah.
So I'm so happy that you're doing that. You're leading the way. You don't know, but you're inspiring a lot of people.
Oh, thank you.
Old ones too.
I appreciate that.
So tell us a little bit about some of the challenges. You talked about, talking even to restaurant owners.
Yeah.
And, there are a lot of mom and pop restaurants that are really suffering
Yes.
because of COVID-19. So what are you seeing out there as some of the biggest challenges?
Yeah, I would say the biggest challenge is COVID fatigue.
Really?
Yes, it's so just disheartening to go on Facebook and to see people with groups of people with no mask on, indoors, no mask on at large gatherings, and it's very disheartening to see that. And it's, frankly, it's discouraging with the work that I do. It's like, I look at them like, how am I able to change people's behaviors? I can't do that. And so I did get discouraged after a while, and I had a little COVID fatigue.
Yeah.
But then I decided that it's not my role to make choices for people. My role is to give them the information, to give, what I can to our communities, and then they have the choice to make the decisions based off of that.
Information is really, really powerful. And I think a lot of times, because the information comes into our community in a way that's not culturally appropriate,
Yes.
it does not resonate. So
doesn't.
it really helps to see people who look like us, who live the same experiences that we have, talk about these issues. And you're right, COVID fatigue is real. The mask thing is a big deal. We've got people refusing to wear masks,
Right.
who know better but still refuse.
Exactly.
I'm introducing actually legislation to actually require a mandate for mask wearing in
Awesome.
public places. And because I think it's necessary.
It is.
It's really necessary so that people really, if we really want to get back to normal,
Right.
and we really want to respect those people on the front line who sacrifice every day, doctors, nurses,
Right.
essential workers, we've got to mask up.
We have
We've
to.
got to mask up. So tell our viewers how they can help you keep doing what you're doing.
Can I say one more thing?
Yes, you can.
Okay, so isolation is another issue in our communities. We live in just small areas. We're in compact areas. We live in shared spaces like apartment complexes.
Yeah.
So it's hard for us to Black and brown communities to isolate if we do catch the virus. So that's one of the reasons why it's running
So
rampant
rampant.
in our communities. And so we need assistance from our local authorities to provide isolation spaces so people can volunteer to isolate away from their families. That is the major challenge that we have.
Well, that's a good point, and it's something that we really ought to be able to address because we were sent money through the CARES Act to do just that. The
Okay,
state was.
yeah.
Well, Tiffany, thank you so much for what you're doing and for who you are inspiring, because I know it's a
you.
whole generation of young people hopefully are watching this and saying, I want to do what she's doing.
Thank you. I really appreciate it. I have to give back.
Always, always. Well, stay where you are. We will be right back.
The Comet gives me a reliable source of transportation.
It's very convenient to me.
and they have wonderful drivers.
It's clean and it builds community. It's fun to meet people.
It makes me feel like really independent. It's just fun.
It's always going to be there and it gets me everywhere I need to go.
We try to ride every single day. Comedy is our livelihood.
Thanks for staying with us. We are just delighted to have back in studio in very festive attire, I might add, John Andow, who is the Executive Director and the CEO of the Comet, the Central Midlands Transit Authority here in the Midlands area. Thank you so much, John, for being with us today. And I must say, I love the outfit.
Oh, thank you, Wendy. I really appreciate you for having me come again.
Well, listen, it's interesting. We were just having a great conversation about mental health services, and we talked about the difficulty of providing transportation even in rural communities for those kinds of services. So it's good to have you back in to talk about what's going on at the Comet. We know just from the previous shows that you all have done a lot of things to improve safety measures, but can you just talk a little bit about some of what you've done from a safety aspect?
Yeah, definitely. COVID-19 is definitely hitting public transit all across the country. And we want to make sure that we're keeping our riders, our employees safe and not being able to contract this disease. And some of the things that we've been doing is making sure that all of our buses are being cleaned daily. We're detailing the buses weekly. We have an employee that actually goes to Comet Central during the midday, Monday through Friday, and he goes and wipes down all the buses as they're cycling through Comet Central every 30 minutes. We're getting ready to relaunch service to Fort Jackson starting this Sunday, and Fort Jackson has also imposed some stringent cleaning requirements, so we'll have a person cleaning our buses at the Forest Drive Sam's Club Super Stop so that every time the bus goes on base, it's also being validated that it's being cleaned.
Oh, wow.
We mandate masks in order to board Comet buses. That's a no exception rule. If you don't have a mask, you won't be able to ride, and this is again for the safety of not only yourself but other people that are going to be in this small vehicle. And then we're also continuing to test our employees every couple of weeks. We just worked out a partnership with DHEC to where they're going to actually do COVID testing for the Comet riders at Comet Central starting next Wednesday, and it'll occur every Wednesday, Thursday, Friday, and Saturdays. And it'll be free testing. And just to help our transit riders be aware of the impacts and to get tested if they don't have time to get tested.
That is really a great service, and it's really important because a lot of the folks who are riding the Comet are essential workers.
Exactly.
And so they've been out here the whole time doing the work. Talk a little bit about some of the special packages I'm seeing online that you are offering at the Comet.
Well, one thing to note is that the Comet system is free. And it's free to all passengers. We get a grant from the Federal Transit Administration CARES Act, which is covering the cost of people to ride for free. So we are only, definitely, yes. It helps the essential worker that has limited income, especially with hours being cut. Mm-hmm. They now have that extra $40 that they were spending on a bus pass to use for something more essential like grocery or other quality of life needs. So that's going to continue for now. Other things that we've been doing is we're getting ready to increase the subsidy for Lyft and Uber from $5 to $8 starting in January. And our Uber-Lyft partnership allows people to either use transit at night, basically from 9 p.m. to 3 a.m. But starting in January, we're going to increase that to be from 8 p.m. to 6 a.m. the following morning. And this is again to help people who need to access jobs at night or need to come home from jobs at night. They can still have some form of transportation. And with the $8 subsidy, a lot of riders in Richland and Lexington counties will now be able to get from point A to point B without having to pay Uber or Lyft any additional dollars.
So do they schedule that pickup and for those Uber rides?
They do.
Just like they would a normal Uber ride?
Yes, on the app. If you don't have a credit card or a smartphone, you can either get a credit card at your local store, that it's a prepaid gift card with the Visa or MasterCard logo, or you could call DART and we'll pick you up for a $10 flat rate. Okay. And then to even piggyback on that, as you know, food deserts is very common in the Columbia urban area. So with our Comet to the Market program, we're also increasing the subsidy from $5 to $8, so those that need to access the grocery store 2 times a week can now be able to do so without, again, having to pull money out of their pocket to get to the grocery store.
And I want to just ask a follow-up on that. So to use that service, is that a service that you're sharing with other people? In other words, do you have to wait until the driver has 3 requests to go to that grocery store, or is this something?
No. Basically, if you want to go to the grocery store right now, just pull out the Uber app, put in the code COMETMARKET20 in Uber or Lyft, and then just schedule your ride. As long as you live in a food desert area, which is primarily the urban cores of City of Columbia and some of the rural outlying areas like Eastover, Batesburg, Leesville, Hopkins, Gadsden, and you just pick one of the grocery stores in the app, it will send you a car within 5 to 15 minutes.
That's a great service. And that too is a part of the CARES Act funding from the feds?
No, we've actually been running that program since December of 2018.
Oh, wow.
And
Okay.
we just continue to enhance it. And now with the additional funds we have, by increasing the subsidy, is allowing us to grow the program even further.
That's a lot of good information. Now, I have noticed that the bus stops are very, very nice, well lit. There is a nice canopy in most places that I've seen. You've done a lot, it looks like, to make sure that there is convenience and protection for riders so that they're not exposed in the elements.
Correct. This has been a huge commitment by our board that they've directed me to build 175 bus shelters in the next 3 to 5 years. And they made this commitment in 2018. So working with our engineering team and our planning staff, we've been aggressively working with SCDOT, City of Columbia, Lexington County, Richland County to permit a lot of our bus stop locations to install that new bus stop shelter design that you're seeing throughout the service area. We're getting fairly close to the goal, but we're still continuing to build, and we hope to install another 25 to 30 shelters actually in January. We're just waiting for the shelters to come.
And they are so needed because as people, as I said, the essential workers who typically are on those buses really do need that extra protection. So it's good that they will have a shelter at a bus stop instead of just standing on the street with no cover in the rain.
Agreed. And I also want to add from a COVID-19 perspective, we are doing extra cleaning on our bus shelters. We're pressure washing them and wiping them down just to, again, keep people safe.
Well, listen, John, I thank you so much for being here today, and especially thank you and your entire team for the work that you all do to make us safely move from one place where we want to be to where we need to be. So thank you all for that.
Thank you, Wendy. I really appreciate me having to come.
Well, listen, folks, that completes our show today. We hope that you've enjoyed it and that you learned something that both inspires and empowers you. We want you to stay safe during the holidays. We want you to wear your mask, exercise social distancing, use good hygiene, and have a wonderful, safe, and blessed holiday. Until the next time,